Thank you for agreeing to do our Get to Know a Caregiver series.
Oh, my pleasure. Thank you. It's a lot of fun.
I wanted to take a minute to ask you a few questions and starting out with where you're from and how you grew up.
Sure. I was born in New York City, but I was raised mostly in Connecticut, so I consider myself a Connecticut native. Um, and my whole life, I grew up in Connecticut from kindergarten through high school. Moved away at various points, but I'm now back right where I grew up. So it's a lot of fun.
And tell me a little bit about your family. How many siblings do you have and things like
Yeah,
that?
I have a brother, parents. We have a small family. We always grew up with dogs. I'm a big dog person, and I'm the only physician in my family, only person in medicine or healthcare. So that's something that I enjoy.
And so tell me about the decision to go into medicine. Like, how old were you when you knew you wanted to be a doctor, and why did you choose
Yeah,
that?
I think I always knew, even when I was a little kid, I would say I wanted to be a doctor, and maybe not even fully, obviously, understanding what that meant. But I loved science. I I think, in a classic way, I probably had really great mentors through my college and, you know, high school and elementary school, going back far. But I really have always loved science, I think, is what drove me to medicine. And probably just with that, I think the ability to then work with people, um, um, probably is what drew me to medicine the most.
Where did you end up going to medical school?
So I went to medical school in Ireland. And I got there by when I was in college. I had spent a semester abroad in Dublin, and I had a great time. And I felt really drawn to the country. And have some Irish background in me, and I just wanted to go back. And I had a really wonderful opportunity to take part in medical school there with a program where about half of my classmates were from North America, and the rest of the students were Irish. So it was an amazing experience.
That sounds really amazing. And what a cool way to learn about medicine in another country.
Absolutely. And there was a really strong emphasis on just your history taking, speaking to patients, and your physical exam skills. And it was fantastic. It was amazing. I keep in great touch with my colleagues from there. So it was fantastic.
And so from after medical school, then you chose to go into internal medicine residency and then ultimately hematology oncology fellowship. Can you
Hmm.
talk a little bit about those decisions and any formative experiences that helped you decide what to do?
Yeah, I had a really, really great mentors. I wanted to be back in the New York. I wanted to be in New York City, so I did my residency training in the Bronx, which was so cool because there is just it's such a diverse place to work, and I had the opportunity to have patients from a number of different ethnic backgrounds, socioeconomic backgrounds, which was really rewarding. I learned so much. I think I ultimately chose um, oncology based on, I do have family members who've had a history of breast cancer, so I think that had some element, of course. But I think also, again, just really great mentorship along the way. I also realized that I was entering oncology at a unique time, I think, when the field was really, things were rapidly changing in a very positive way. And our knowledge, science was changing. And I mean, every day, I think, we get new information about how to diagnose things, treat cancer. And I just thought I want to be involved in this exciting time. And so that was a large part of what drew me to oncology. And then, of course, I think it's a unique field too, where we get to um, really get to know our patients, on a human level. And I remember one of my mentors at the time said, well, think about, what kind of patients, who do you want to be sitting across, in the room with, and what kind of conversations do you want to be having? And that really somehow just that stuck. And it's something I've never forgotten. And I just realized that this is what I think I was meant to do.
It's a privilege to sit across from a patient dealing with cancer, I feel.
Absolutely. I mean, it is such a privilege to get to be involved in the medical aspects, of course, of what we're doing, but to also have people allow you to really enter their lives, meet their family. Cancer impacts people, of course, on a day-to-day basis, and how they are with their own family and their jobs. And it's really actually an honor that patients allow us to be involved in that.